Hi, this is Cherberg, and I'm doing my lesson today on auscultation of the lungs with help from Terry Schultz and our patient here, Mackenzie. Today, Terry, we're going to learn about how to auscultate the lungs, and we want you to be able to explain the reason why we do this, describe the lung sounds that you hear, and then interpret the breath sounds that you're going to hear when you're auscultating the lungs. So the first thing you do is come in and introduce yourself to the patient. Hi, I'm Nurse Herberg, and I'm going to listen to your lungs today. We want to make sure that the patient is sitting comfortably and breathing comfortably. You want to take a look at their skin color and how they're breathing, and make sure that you're seeing that they're not having any trouble with breathing and that they have a good skin color. And the reason why we auscultate the lungs is not only to listen to lung sounds, but also to determine if there's any problems with the cardiovascular system, because we can get fluid being backed up into the lungs, and that's you'd also hear that when you were auscultating the lungs. So you're going to make sure that your patient is comfortable, sitting comfortably. You take your stethoscope, put your stethoscope on, always clean the stethoscope, wash your hands before, of course, and then always clean your stethoscope to make sure your stethoscope is clean. But if you do this in front of the patient, it also helps them to feel that you're using a clean stethoscope. So when auscultating the lungs, you're going to go across the lung fields, which is here by the trachea, and then down here by the bronchus, in the middle of the lungs, and then down on the bottom part of the lungs. And then you're going to do the same in the back. Both spots in the back, in the middle of the back, towards the lower part of the back, and then below the rib cage. You're going to just put your stethoscope in your ear. You're going to ask your patient to take a nice deep breath. Take a nice deep breath. There you go. Let out. And again, nice deep breath. Oh, beautiful, beautiful lung sound. So what we're looking for here, again, okay, one more. And then down here, one more. And one more. Okay, I'm going to stop here for a minute, and what we're looking for is the different types of lung sounds. So if you would hear a high-pitched noise up here, that would be stridor, and stridor is caused from the trachea being narrowed. If you were to hear some bubbling noises, that's what's called bronchi, and that's usually caused from some type of bronchitis or some liquid in the lungs. If you were to hear some crackling, we used to call that rales, but now it's basically crackling, that can indicate that you have some fluid buildup in the alveoli, which happens during pneumonia or patients who have emphysema. And then, or you'd be looking for wheezing, which is a high-pitched noise during inspiration and expiration, and you'd hear that a lot in children this age, because it's often an indication of asthma. So why don't you give this a try, and you can take the stethoscope. Let's wipe it off again, just a good way to remember to clean it. And then listen to Mackenzie's breath sounds in the back, and let me know if you hear any of the breath sounds that we talked about. Here's a handout for you so that you can refer to the different type of breath sounds. And then also, for all of us that have smartphones, we also have, I have an app on my phone that if we have time at the end of the lesson, we can listen to what the abnormal breath sounds actually sound like. So why don't you go ahead and give that a try, Terry, and we'll see what you think.
Mackenzie, I'm Nurse Schultz. I'm going to listen to your lungs. I'm going to start at the top. Position 1, take a deep breath in and out of your mouth. Again. Moving down to the next position. Deep breath in and out of your mouth. Again. And then the lower position. Deep breath in and out of your mouth. And again.
And I think that's great, and the timing's great. Are you hearing anything unusual?
No, it's clear at this point. She sounds good. Now
all right, let's try to do the back then.
Okay, take a deep breath. breath in and out of your mouth. Again, in and out of your mouth.
One of the breath sounds that I did leave out was the actual absence of breath sounds. That is indicative of pneumonia. So if you get down through the lobes and you hear nothing, that means that there's no air being sent in and out of the lungs, and that's also a finding that you would want to report.
Okay.
Well, I think you did very well, Terry. Let's see if we have enough time to take a minute to listen to these breath sounds. Here we have what a normal inspiration would sound like. Just a normal in and out of the lung sounds. And then let's get our technology to work here. And then let's see, we have, that's inspiration. Let's see, some expiration. This should give you some wheezing noises. You can hear that wheezing. So I think as a student, this is a great tool to be able to use to, if you hear some breath sounds and you're really not quite sure what you're hearing, you can't remember, is this a crackle, a rail, or a crackle, or rhonchi, which is the bubbling, or wheezing or stridor. This is a great tool to be able to use to refer to be able to document appropriately. Well, I think you did a really great job today, Terry, and if you have any questions, I think it'd be great if you just review the handout, and once again, use our modern technology, and that'll help you to learn the breath sounds. Kenzie, thank you for helping us. You're a great patient today.
Thank you. Thank you.